you ready for some football? Every Friday night, Fox Connecticut shares highlights of the hottest high school games out there. But this morning, we're talking about the risks involved with taking the field in the fall. Now, we're not only talking about football, but it's common knowledge. Anytime kids play sports, there is a risk of them getting hurt, certainly a risk of them getting seriously injured. Fall is field hockey season, soccer, swimming, and of course, ice hockey, which some do all year round. This morning, we're talking about what happens if a student gets hurt with Dr. Robert Arciero with the UConn Health Center. Doctor, thanks for being with us.
Thank you.
We just mentioned a few of the fall sports. Another one, ice hockey, which I know some kids do all year round. What is the most common injury that you see in younger kids?
Yeah, probably in younger kids, it's overuse injuries, actually, because a lot of families have their children in multiple sports in the same season. So we'll see a variety of shoulder, elbow, and knee overuse injuries. That's probably the most common injury that we see. In the contact sports, we see, of course, a lot of knee injuries and concussions. And so, you know, protective athletic equipment is very important in the fall.
Do you see any variation between boys and girls?
We do as they get a little older. The adolescent,
like high school age?
Yeah, and adolescent women have increased injuries of anterior cruciate ligament tears. That's pretty well known. So that's one thing that can certainly put the athlete down for the season, and to have that kind of injury at a very young age is a really tough problem to overcome.
Now, you're just talking about the ACL.
Yes.
So that is one of the more common injuries that you see. So explain to people who may not be familiar with it what it is and what the treatment is, since it is one of the more common injuries.
So the ACL is the anterior cruciate ligament, and it is a ligament in the center of the knee, and it's responsible for controlling abnormal movement of the lower leg bone on the thigh bone, tibia on the femur. And when you tear it, the knee becomes sloppy, unstable, and so when someone has to cut and pivot, the stability of the knee is not there. And so that's why it's a pretty devastating injury. And the treatment in young people is almost always surgical to stabilize it. It's very tough to ask a kid to give up their sport or become a couch potato, you know, in their young life. So we almost always operate, and this involves taking a graft from the knee and putting it into the knee to rebuild the ACL.
Now, I tore my ACL several years back. I didn't realize it. I thought it was a sprain, so I waited a month or so before actually going to the doctor, and that is essentially what you should not do, right?
Well, you know,
you should see a doctor immediately. I thought it was just a sprain, and I thought it would, you know, get better over time.
Your story is really not that uncommon. We certainly see more kids and adults who come in right away. You know, they had a volleyball, basketball, skiing injury, something like that. Soccer. You know, adult soccer leagues flourish in the fall, and that's when we see a fair number of ACLs. But your story of, you know, just sort of grin and bear it, and it's nothing much, and it's gonna get better, is not an uncommon story, honestly. So
then, when do you know whether or not you should go right away?
Well, I mean, usually.
What would be a determining factor, say, if it is there any way for you to tell on your own whether it is, in fact, a sprain or just bruise, which is something more serious?
Yes. A couple of signals. If you get injured to the degree that it causes you to stop participating in the sport that day, and if your knee swells, and then the next day you notice that it's stiffer, and more painful, and you're limping, something bad happened. So you need to go see your sports doctor.
Yeah, and these are all things that parents should keep in mind, even though a lot of times they tend to push their kids a little bit more maybe than they should.
That's very accurate comment, no question. If a kid comes up lame and cannot participate the rest of the game, and the next day is a big thing for me, then something more serious happened.
All right, Dr. Arciero, thank you so much for being with us.
All righty, thank you.
Great helpful tips.